Well, hello everyone. This is November 2024. This is Tustin Longevity Center. And I am Dr. Ellithorpe with Tustin Longevity Center. And we are a functional medicine integrative group. We are here every Tuesday at 6 p.m. to 7 p.m. We take questions. Ask the Doctor Anything, I guess, is the title of our YouTube, and family, friends, people can ask questions of all sorts. Doesn't mean that I'm going to have all the answers, but I will give you the response that I have for functional medicine, having practiced this, nearly 40 plus years, and being trained by a father in food research. So we have a huge volume of experience. We do this as a educational benefit to our YouTube friends and family and our patients, but we are not telling you over the YouTube how to manage individual things. So we can ask about concepts or symptoms, and we will give you how we feel about it from a medical, functional, experienced point of view. But you have to see your doctor, and you have to be managed, of course, by your local doctor. Or if you are a patient of ours, you need to come here or, send us a message. You can reach us and ask your questions here on the email by contacting us at the website TLC Doctors, plural, tlcdoctors.com. And then there you can get on our newsletter. And then finally, if you get on our newsletter, we send you a notification of our weekly Ask the Doctor Anything. And on that email there'll be a link there where you can type in your question. Of course, we need it concise, no long histories and stuff. We're not practicing medicine over the YouTube. Now, we also have the YouTube where you can type in your questions here, and we would like to answer those questions as we see them come in live, because they're the ones who are here watching at the moment. But we'll use our email questions until we see some questions come in. Shalom Shelby from Santa Barbara, California, is saying hello to us. Hello, Shalom Shelby. Glad to see you here with us. And our first question we have on our email questions is from Christine. Is using testosterone using testosterone alone recommended for a senior 73-year-old with multiple health complications? Well, it would depend on what the complication is. For instance, if the 73-year-old is a male and the male has prostate cancer, adenocarcinoma of the prostate, then there would be a question whether or not it would be advisable to use testosterone, because one of the methods they use in managing prostate cancer is blocking hormones with hormone blockers. But outside of that question, in general, if you're a male or a female, because females benefit as well from testosterone, we have seen many, many benefits by restoring supportive natural hormone replacement therapy with our patients. And that because your muscle mass, including your heart is a muscle. And one of the ways they used to treat heart attacks in the past was they did give testosterone to help with the strengthening of the heart. So testosterone used in cardiovascular, in musculoskeletal, in just a sense of well-being, in cognitive disorders, Alzheimer's, dementia situations. Very often, if we replace the testosterone, we do see improvement, especially in males. So on a basis of mobility, cardiac function, which will enhance circulation, which will help metabolism, this also will help with repair of tissues and joint support and mental acuity. So there is a multiplicity of the value of natural hormone replacement therapy in people with multiple health complications as a general rule. But again, we want to work on an individual basis and make sure there wouldn't be any contraindication for men and women. By the way, the levels, back in the 1970s when I first started into medicine, um, the levels of testosterone, I started writing a book on this back in the 1990s, and it was way ahead of its time, and it wasn't supported. And I was a busy doctor and mother, so I first started writing this back in the 1990s, and that was because since practicing medicine in the 70s, I had seen a direct drop in the male testosterone levels and female testosterone levels. So that women today, let's see, when I was in my 40s, um, I had a testosterone random sample level of 93. And today, if a woman was in her 40s and she had a testosterone level of 93, they would call it high. If a man had a testosterone sample today and he's 60, let's say, his level would be 300, 400 range. In the 60s, when I was taking care of active duty military men of various ages, and we had a lot of retirees around the forts that would come as well. Um, their levels were, 1200, 1400, 1600. So these levels, you can say they're not helpful if you use tiny low levels of support. So if you're going to see a therapeutic response, you need to have an awareness of how health used to be in the 1970s and the levels then, and try and approach those levels. Hopefully that's helpful to you, Christine. All right, John. John asks a question. Do you think it's beneficial to take probiotic supplements daily? In an answer, yes. Quickly, yes, I would say probiotics. Our gut health, there are so many people say that disease begins in the gastrointestinal system and the whole system. There are, plus the tube, and there are so many biofilms. The flora in your gut is tens of thousands of strains and families of bacteria and fungi and uh, even viral parts as well. And we have trillions of these things in us, so that you could say numerically we're made up of more by number of this bacteria than the cells that make up us as a human being. As we age, depending on our lifestyle, what we've been through, antibiotics, alcohol use, high carb feeding this bad bacteria, we can make the environment of this gastrointestinal flora worse and worse and worse, because these bacteria help make vitamins for us. They help make products, byproducts of their metabolism that are beneficial. Short chain fatty acids help us stabilize, like butyrates for the DNA in our cells. There are many, many beneficial things they do. On the alternate side, some of there are bad bacteria, you might say, or dysbiotic, that harm us and tear us down, inflame the lining of our gut, and then it shortens our life. So it makes all the sense in the world. And we have been saying this for decades. I've been using probiotics in healthcare 35, 40 years already. And I'm so glad to see younger doctors and specialists and gastroenterologists all confirm everything that, by the grace of God, we have been doing for many decades here. The low carb, ketogenic diet, the exercise, the grounding, earthing, the healthy sun, vitamin D levels, testing for inflammation for decades and decades, long before this became a fad. And these extravagant items on the YouTubes are flares and flames. Very often they'll pick up one thing and say, oh, this is new. Unfortunately, we've known about it for decades. And so I'm glad, very glad to see that they're learning, that they're talking about it. But there isn't any one solution. It's a style of living and a commitment to take personal responsibility for your diet. I just got back from my workout. I did it before the video today, so I'll be um, perked up a little bit. All my muscles are puffy now from all the hard workout I did. So I'm in my workout clothes. But everything you do has to be a part of your health, not any one thing. So probiotics is certainly a valuable thing, but it's not the only thing. But I certainly would add it. Let's see. John adds the question: do you provide IV chelation N-acetylcysteine (NAC)? Um, we can. We have in the past. I don't do it regularly. I heard that it could improve homocysteine levels and lipoprotein little a. Indeed, there are studies that do show it is beneficial. It's a powerful antioxidant, and anytime you give antioxidants, it will benefit diminishing waste level buildup. And homocysteine is basically a waste that we're measuring. And so I'm not going to say no, but does it need to be done and maintained N-acetylcysteine IVs? If you want to play the fad, yes, you can find a place that will charge you hundreds of dollars for it, and you can go do it. But what you really need is a doctor relationship where they're going to be there, they're going to sit down with you, and they're going to say, yes, NAC will help. Yes, it is available as an IV. But by the way, let's get back to what really works every single day and costs you nothing. Are you doing weightlifting? Are you drinking enough water? Are you not eating late? Are you avoiding processed foods and things like this? Are you lowering your carbs? So I see IV chelation N-acetylcysteine as a flame, a flare. It's a fad. It individually has a powerful antioxidant value. It works and was used to be called a drug for Tylenol overdose in the 70s and 80s. We would administer it when I was the ER doctor. And then it helps to be a mucolytic agent, and there's even a suggestion that it helps with neurodegenerative diseases, Parkinson's, and the like. But why is that? It is a powerful antioxidant. But you can't live on an IV. What you want to do is change your lifestyle and change your diet and improve your hydration and reduce the sticky carbs and get your body moving and get it in the sunlight and get it to bed on time. You want to do all these wonderful things so you won't need excessive amounts of a nutrient like N-acetylcysteine. Let's make a lifestyle. Let's keep it as an isolated, maybe supportive thing, depending on what you and your doctor figure out. But oral and IV is available, but I think it's mostly a fad. We're starting to get some live questions here. Let's see. Tiziana. Hi, Tiziana. Good to see you. Hello, she says. A friend of mine needs to have surgery and is worried about taking antibiotics. I suggested she takes powerful orthomolecular probiotics afterwards. Which ones would help her post-surgery? Very often they do antibiotics during a surgical procedure to avoid any complications, especially with joint surgeries. But as a general rule, it's a preventative standard of care during surgery. You can talk with your doctor and sign a consent form if you're concerned, saying, I elect knowing the advice of preventive precaution by administering them. I know that some surgeons have been asked by their patients not to do it, and they honor them. Your surgeon may or may not do that. They may say, no, I think it's reckless not to use antibiotics during surgery. So for me, I will give them. If you have to have the surgery, then you have to have the surgery, and you have to have a good doctor. And I think many surgeons are sincere in believing the antibiotics are protective. There have been uh, less post-operative infections, so I would go with their advice. But what can you do? I would say uh, eat a very low carb diet. Be very low on your sugar, starch, and fruit sugars, and I would take a probiotic. I would take we have Orthospore IG. This is a type of family of probiotics that's very, very good. And then I would take the bifidobacteria, lactobacillus, more of the gram positives in the form of Orthobiotic 100. When you put the 100, you're saying you want the stronger form. So take that with a very low carb diet uh, before the surgery, weeks, days, months, as long as you can. One of each of those Orthospore IG and then the Orthobiotic 100. That's what we have here. That's what we've tested. Right after surgery, though, I would add in addition, so this would be the third item to take, and I would do it for a full month, is the powdered probiotic 225. It is a powdered form of the 225, 225 billion count. It's a powder, and you can take it, mix it in some water daily, and that'll help protect you and have less overall damage to the GI system. Because there are those articles and gastroenterologists doing research now that have even proposed that up to 2 years after a dose of antibiotics, you can see damage to the flora and the activity of the gut. So that's what you can do, and that's what I would recommend. So Orthospore IG, and then probiotic 100s, and one of each of those capsules prior to the surgery for days, weeks, or even months. But right after the surgery, when they can eat again, take the probiotic 225 powder in addition to the other two. That powder should be used daily for about a month. That's what we do. Another live question from Christina. Hi, Dr. Ellithorpe. What do you recommend for the winter blues? I live in the Midwest, and I grew up in northern Illinois, southern Wisconsin border, and I know what you're talking about. I live in the Midwest, and winter is long and dark. Thank you. Well, I would get up with the sunrise. I would set up my life and my lifestyle to wake up with enough time before the sun rises to get what I need done. Very often, I like to do for myself. My as my worldview is as a Christian. I overview the lens I see the world through as my Christian overview. I do my Bible reading in the morning hours before the sun rises, and then that I read maybe 3 chapters of the Bible, and I go cover to cover every year. Then with that, I get this peace that passes understanding, and a calmness and understanding that I will go to work with my Lord, that He'll help me. And then I see the sun rising up, and that just goes so nicely with my Bible study, and and the hope it gives me. So that's a mood elevator, because my mind is being worked on as I read and flow over these wonderful scriptures. And so what you feed your eyes is what is going to give you a mood. And for me, my mood, my antidepressant, my anti-anxiety management is reading the Word of God every morning. And then with the sunrise, I get out and I stand in the early morning sun for about 3 minutes. That powerful infrared light is very valuable. Now, I know up there it's going to get snowy and cold and 15 degrees and stuff, and it would be very hard for you to stand in the moist mud or grass, whatever is up there. But I do kick my shoes off and I stand about a minute and a half to 3 minutes with my feet on the wet dew every morning here. But if you're able to, you can get a grounding mat. There are also lights that are designed for seasonal affective disorder. That's the sunlight, the specific wavelengths that are designed to your body, your eyes should take in. These are mood elevating lights. Exercise is another thing. You've got to exercise, and I would do both weight and aerobic training, weightlifting 3 times a week. And you can see I'm doing it. I'm in my workout clothes now. And then I would have a rebounder in your house, or a treadmill, or an elliptical, or something that you can do exercise with. I would be well hydrated. I would take vitamin D supplementally. I would take the 10,000 international units as a minimum. Ask your local doctor to check your blood level within a few months. And if it isn't about 80, if your blood levels are only 50, 60, I would use 2 of the 10,000 and go to 20, and then repeat your vitamin D later, a month later or so, and see if you get your vitamin D up above at least 60 to 80 range to get a mood elevation from it. And I would be well hydrated. Don't underestimate the power of water. Water is very important for your brain and your mood. And then the B vitamins. I would take a methylated B complex, and those are some of the things. Of course, I'd eat low carb, and I would eat plenty of protein so you can make your neurotransmitters and stuff, which need amino acids. So that would be what I do for the winter blues. But it's a lifestyle. See, I don't need to worry about winter blues, because even through the summer, 3 times a week, I did my weightlifting. I do my fast-paced walk. I have a dog to walk, and then I have my water rules. I drink my water. I have my low-carb lifestyle, rich in protein. I take my D10,000, 15,000, 20,000, and then I take my methylated B. So there isn't anything I need to change. But that's what I do, Christina. And then Annetta says, what is your best advice to grow thicker hair? I am 73. Well, I'm about your same age. I have thin hair. What is what is your opinion of 2 homemade recipes? The first one is a half a cup of castor oil and a half a cup of coconut oil and 10 drops of rosemary essential oil. The second recipe is peel a avocado pit, grate the inside of it, next soak grated pit in olive oil, then last put this on the scalp. Do you think either of these will work, or do you have a suggestion? Annetta, I've never heard such a wild type of home remedy. That's wild. No, I don't think either of those will work. In 44 years of practicing medicine, all the time, no time off, I would say I've seen at least 100,000 women say, how do you get thick hair? My hair is falling out, my hair is thinning, and on and on and on. What is my answer to that? Hair is made of protein. What has this country done? It has basically poo-pooed eating protein, and it is glorified fast food, hydrogenated, fried items that are harmful, inflaming to the body. Inflammation will damage your hair, all your body, but in particular your nail and hair growth too. Inflammation damages everything in your body and ages you prematurely. It stresses you. Cortisol will fight hair growth support. So your stress hormones, you need a good night's sleep. So I tell my patients, if you want to grow like a garden, a good head of hair, you have to have a good scalp thickness for that hair follicle root to grow in and get a blood supply. So I recommend EDTA chelation therapy, ethylene diamine tetracetic acid. I've probably done 300 IVs since I was age 16. I eat a low carb diet and exercise to keep the circulation going. I take enzymes to keep my inflammation down. I don't use anything on my hair whatsoever, and I wash it as infrequently as I can. I use Selsum Blue for the selenium rich, which is uh, a lower mineral that we need on the scale of minerals, but we need many minerals. But if you eat meat, fish, chicken, turkey, beef, eggs, fish, all those kind of things, you're going to get a lot of minerals. But the older you get, the less you digest, the more inflamed the tube is, the more leaky membrane you'll get on your gut, and inflammation towards we're fighting death is what we're doing. Cell damage is cell death, which is death. And you have to eat the fat, you have to eat the protein, and you have to use a digestive enzyme is what I'm getting at when I eat at my age in the 70s, so that I can extract the protein, amino acids, the microcirculation from the exercise, drink my half my weight in pounds as water every single day, and do the chelation to improve the microcirculation. So I've got the protein, I've got the circulation, I've got the hydration with the water. I reduce the stress by trying to go to bed, 9:30, 10 o'clock every night, getting up at 4:35 every day, just having this routine. So the protein and the exercise and the microcirculation and the minerals, I think, are what does it. And trying to reduce your stress. As far as oils, they're in the meat, they're in the fish, they're in the chicken, and I only eat roasted chicken. Like before I came here tonight, because I worked out at 3:30 till 4. I was able to have my chuck roast, and I ate about 3/4 a pound of slow roasted beef. I just took in all that wonderful roasted beef just now, and it's going to help repair my skin, my hair, all these things. So this is what I recommend, Anetta. Next is uh, Rebecca. Rebecca says, do symptoms of having high cortisol levels look the same as perimenopause in women? Yeah, there's a lot of overlap. Yes, Rebecca. What are the differences in symptoms, and what is the best way to test both accurately? Well, you have to see a real doctor is going to take the time to see what is your age, what is your life stressors, what is your lifestyle, when are you getting up, when are you going to bed, how much water do you drink, how much protein do you take, and then when was your last menstrual cycle, do you use progesterone or not, and sample that blood in you about 2 weeks after your last menstrual period started. So about 15 days after your period starts, the period start is day 1. That's when you sample for estradiol, progesterone, testosterone, DHEA, cortisol in the morning. And then the older you get, the less likely you ovulate, the less fertile you become. And if you're not ovulating, then you're going to be estrogen dominant. Estrogen dominance from perimenopause can lead to fibroids and more painful menstrual cycles, irritability, mood swings, trouble with sleeping, less regular cyclical hormones will create disrupted sleep, which will then amplify stress, which makes more cortisol. This is a pattern of aging. So, good doctors who are functional doctors will be sitting with you to kind of get into your skin and say, what is your life like? How much stress? How much protein are you eating? How much water? How much exercise? Um, and where is your cycle at? What are your blood levels? And now, just straight cortisol problems are more primary cortisol diseases are more rare than secondary cortisol problems from life stressors and world environmental toxins. So Rebecca, the answer to that is getting with your doctor, because there's no one test to separate perimenopause from, secondary cholesterol problems. What there is these are interwoven, multi-system challenges that age, time, toxins, environment, stressors, sleep cycles, diet, and your most recent cycle of menstruation, all these impact it. And that's how you figure it out. Uh, we had another add-on question in the live by Annetta. Oh, thanks for your chuckle regarding these ideas. I laughed too. Thank you for your very helpful reply and advice. Well, Annetta, thank you very much. It's just fun to talk. This is how we learn. This is how we help each other. I can't see everybody on the planet, but I can certainly give inspiration to our fellow doctors, try and train up healthy, new functional doctors, and just fall in love with people, just fall in love with trying to help them sort things out in their life and step by step build a process to get better, and so forth. All right. Thank you for that kind statement, Annetta. Let's see. The next one here is Alex. And Alex says, oh, well, that's nice. He says, hi, Dr. Ellithorpe. Love your channel. I get numb fingers and cold hands, especially with temperature change. Non diabetic, healthy 50-year-old. I notice it more after rigorous workouts while reading and sleeping. So these are the situations he sees them in. I can drop things easily. Rotators are both torn. That's talking about his shoulders. Started 20 years ago, getting worse. I do yoga. Will iodine or B complex help? Many things. Well, Alex, the answer is yes. B complex and iodine will help because they're all involved in the metabolic pathway. So there's no way we could just say, well, no, iodine won't help or B complex. They are part of it. But what you're describing, Alex, sounds like Raynaud's phenomena, Raynauds, Raynaud's. And that is, a autonomic nervous system reaction to stressors, either the cold or the stress of the exercise or sleep. Maybe during sleep, unawares to you, your oxygen saturation drops because you might have some sleep apnea. You need a workup, Alex. You need to have a good functional doctor see you to do a workout, look out for pre-diabetes. And just remember, what your doctors are calling normal labs are really population averages out their illness to, it's like grading on a curve. So I don't want to be graded on a curve with people who are getting obese and diabetic and heart disease and cancers and all these things. I want to go to a doctor and say, what's the healthy person like? What numbers are those? Don't give me lab averages of populations. So I'm saying that because if your blood sugar is higher than 85 fasting, then I'm suspicious that you're pre-diabetic. If your fasting insulin is higher than a 4, then I suspect you're a pre-diabetic, which will aggravate the numbness, paresthesias, B12, neuropathies, tingling, numbness feeling, and poor autonomic vasomotor action of the hands and fingers under stress. So you should have, you're 50. You should, be seen and screened for have you had your first colonoscopy, your PSA, your digital rectal exam, prostate size, cardiovascular for your heart pump, and the ejection fraction for blood flow dynamics. You should have your lipid profile, triglycerides. If your triglycerides are higher than your HDL from your exercise, so if your triglycerides are 150 and your HDL is only 60, then in my opinion, you're a pre-diabetic. If your hemoglobin A1C is much higher than 5.3%, you're a pre-diabetic, because diabetes is exploding. Even in children, obesity is exploding. We see a rise in cancers. We're seeing a rise in neurodegenerative disease. We spend $4 trillion on the healthcare in the United States, and we have the sickest people and one of the worst neonatal death rates in this country. Something is wrong with the specialists you're going to see. Something is in error with the specialists you're calling on for very special, high priced advice. And I think it's because they don't have a true physiologic metabolic understanding of your body. They see a narrow pathway they're managing, and they're following averages, and they're not thinking outside the box. Uh, and in my Christian worldview, I just don't think they care. I just think they're only doing things medical legally. They're following a protocol to not be, taken to court over this. Instead, I would like you to have, we have 1 million licensed practice physicians in the United States. 800,000 of them are specialists. 200,000 of them are people like me, primary care, general practice, internal medicine, family practice doctors. The whole thing needs to be flipped. We need a bunch of loving, stable, always present, not moving around, family, general, internal medicine doctors who know you, know your family, know your children, and even your grandchildren. They stay put. And they can see trends, and we're the front line. And I didn't need any continuing medical education course. I learned myself all along, listening to patients, seeing the changes over time of the blood tolerant ranges for sugars and insulin and stuff. They didn't even do insulin. I was saying, how can I test this back in the 90s? I was one of the first to do homocysteine, one of the first to do HSCRP. I was at all the functional medicine, American College for the Advancement of Medicine studies, looking, learning what's going on, reading, opening up books, and so forth. And all of this stuff, I'm so glad to see finally is becoming mainline. Praise the Lord. To him be all the glory, because it benefits the people. But if it isn't in the hands of a person who is your healthcare provider, who cares about you, who loves being a doctor and loves people, I think you're going to get stuck with a protocol man. And, that's just how I feel about it. How did I get down this road? This is all about your tingling paresthesias and stuff. So you need a doctor who's going to look down this whole road for you. And you probably most definitely need EDTA chelation therapy, get a heavy metal done, look at your autoimmune phenomena, autoantibodies, food allergies. Leaky gut is probably highly likely happening to you. Find out your blood type and get on enzymes. And for heaven's sakes, please drink enough water every day. Nothing will get better without water and a good night's sleep and some exercise and a low carb diet. Leah says, what are your thoughts on German New Medicine? German New Medicine is a YouTube channel. They have YouTube, but they're a website. If you put in German New Medicine, there's a woman and a man. They're foreigners, and they lay out, everything from A to Z in the healthcare system, and they have some link on it regarding functional medicine, integrative medicine, alternative medicine. I only know of them superficially. They may be very good. When I did my doctorate in integrative medicine after my medical degree in family practice, I then did the doctorate of integrative medicine. And many of the teachers that we had were from Asia, China, Chinese medicine, Bach remedies, a lot of German on functional medicine, energy according to Vol, uh, applied kinesiology, Klinghardt, Omura, all these big names in integrative international medicine, because Germany had tremendous uh, medical knowledge. So I don't want to say anything negative about German new medicine, because they have a huge volume of information, and they are trying to get doctors to become more holistic and multi-system and see patients longer, teach them, talk to them, engage the patients into taking responsibility for their own health along with the doctor, and do follow-ups to build towards something. Get a consult with a specialist if it is needed, see a specialist. And this is what I perceive German new medicine to be. Their internet method of trying to collate all this into a internet site. Can I endorse everything they said? No, because I haven't read the whole website. It's voluminous. I can't even begin. I can start using it as a reference site. But so that's what I know about German new medicine. It's probably some very good advice. Let's see, we have a new question here. Whitslack. Whitslack. Hi, dear Dr. Rita. Thank you. Would you think it wise to have either a MRI or a biopsy on a person whose PSA increased from 3.6 to 4.6 over the past 6 months? The MSN is in testosterone. The man is on testosterone. Well, what I'm going to say is the MRI is what I would choose, because the older the man, the more likely the PSA is going to be higher on the average. There's a saying that if you biopsy every 85-year-old woman's breast and every 85-year-old man's prostate, you will find some adenocarcinoma of the breast or prostate. You will just see it there. So I don't know what your age is, but yes, get the MRI and look. They'll look to see if there's a lesion in the prostate, and they'll look to see if it's near the capsule. If it's breaking through the capsule, then we have a concern. A lot of doctors are electing an older gentleman to be less aggressive in treatment or biopsying it, because it is a risk to get a prostate biopsy. I know of a man, not this is rare, very rare, to die, but he got a sepsis, and he died. So that's it's not a small thing. We don't blink at it and tell the patients it's no risk. It is a risk. So follow your local doctor, follow him. And I think the MRI is a very good first step. Of course, all the things that matter are low carb diet, intermittent fasting, occasionally do a prolonged 24-hour to 48-hour fast, IV high dose vitamin C, systemic enzymes, never ever eat late, exercise, all these wonderful things you can do. If you're on testosterone, I don't think it's a problem. And just work it up and get the MRI and find out where you're at and what you're going to do. And then work with your local doctor on that. But I would go for the MRI. Carolyn Morelli, she says, what about the turbo cancer theories going around since COVID and the vaccine? There is, without a doubt, a significant increase in the diagnosis of cancers, especially in younger and younger people. I think it's highly suspicious. The correlation does not mean causation, but it's highly suspicious about the intervention of that mRNA injection. Also, there are theories out there that the mRNA spike has been engineered, is not a natural occurring thing, and has in it, along with other vaccines, the SV40 from the green monkey cells that it was grown in, who carried viruses that were known to have cancer risks. So we have this concern. What can we do? We can do all the wonderful healthy things and EDTA chelation, high dose vitamin C, systemic enzymes used, even taking things like N-acetylcysteine orally, quercetin, fasting episodes, intermittent fasting. All these things, along with EDTA chelation, are very valuable in helping prevent this, because in my population who does all these things, we have really very little new. I'm just getting new patients that are coming to me now with all these cancers, unfortunately, at younger and younger ages. So I do think it's of serious concern. It needs to be legitimately looked at so that we get definitive answers rather than our well-grounded suspicions. Jenna says, hi, my husband is 69 years old, healthy, on no pharma meds. His PSA increased 2 points to 6.8 last month. It was 4.8 last year. Just saw a urologist on Friday. Redid the blood work for PSA and a urine test. Well, once again, the PSA tends to go up with age. The more you sit on your prostate and squish it and squeeze out the blood flow by sitting on it, especially if you're on a motorcycle or bicycles, um, and if you have sexual intercourse the day before you have the blood test, that can be associated with increases in the PSA. So I would not have relations for 2 days prior to the blood test. I would do all these healthy things. I would get an MRI of the prostate gland and go from there. The Gleason score is, Gleason came up with a testing methodology on a scale of 1 to 10, 10 being a very malignant, aggressive type of adenoprostate cancer, and 1 to 4 being pretty much 1 to 3 being pretty much nothing. 4 to 7, that range was intermediate, and there have been arguments made in the past and recently that men who are older, who have a Gleason score of their prostate biopsy pathology read as a Gleason score total of 7, if you do nothing, it's the same as if you tried to do surgery or any chemotherapies as equal. It wouldn't make a difference if you did nothing over a 10-year period of time. So you could choose to do nothing, and those men with a Gleason score of 7 or less versus the men who had a Gleason score of 7 Gleason, and they did something, didn't extend their life at all. So this is something you have to discuss with your urologist based on what testing you may or may not do. But I would definitely get an MRI of the prostate to look for nodules of the prostate and look for capsule transgression or breaking through the capsule of the prostate. You don't want it to break through the capsule, staying contained there. And then living a healthy lifestyle, very low carb, the high dose vitamin C, systemic enzymes, EDTA chelation, all these things are very, very, very beneficial. Tiziana asks a second question. Dr. Rita, what would you think of pulsed electromagnetic frequency band? I think I have one myself. They are very good. I don't have a yard, so I can't really practice earthing. Also, I read is helpful for sleep. Thoughts? Yes. The PEMF, pulsed electromagnetic frequencies, they have these kind of like ropes. You're laying on a mat. The electrical current goes in one direction through these ropes with plastic around them. And over the bed is the receiver end of it. So when you bring it over your body, this electromagnetic energy will pulse your energy over the muscles there. You can't not do it. And you can put it over your neck and it'll help, trigger those muscles, any part of your body. So it helps stimulates muscle action and cell depolarization. Many, many, many people are benefited by it. I am literally on a EMF mat. This magnetic mat is a grounding mat with my bare feet right under my desk right now. So yeah, I believe in all those things. They're useful. Jenna says, no results back yet on PSA retest. The doctor recommended an MRI. Yes. If the number's above 4 or 4.5, what is your advice? Yes, do it. Follow the advice, of course, your local doctor. Jenna says, please see my first message about my husband's PSA. I saw that. Thank you for your advice, doctor. We love and appreciate you. Blessings to you and your family. Well, blessings to you all. Yes, okay, and then I have a few more minutes. Let's see if I can get some more of these mailed in ones done. Alan says, is metformin okay to take? I have read different things about it. Metformin is a prescription medication that basically tries to mimic the natural occurring herb berberine, Berberine. And that helps with sugar metabolism. The metformin changes the structure of it so they can own it and patent it and make money off of it. The medicine itself suppresses the production of new glucose from the liver called gluconeogenesis. It prevents glucose absorption from the stomach. And it, I believe, also helps reduce insulin sensitivity. Now, there are many side effects to this drug. Most notably, I've seen are the nausea and diarrhea, or conversely, constipation, which can be very irritating. I would say about 30% of the people who use this have these problems, some nausea and vomiting, 30% at least with diarrhea. Then there's headaches, migraines, and there is a black box warning on metformin. What is that for? The black box warning on metformin is, I can't remember it right off the bat. But so my question is, instead of commercials promoting medicine to treat diabetes and your blood sugar, why don't we get rid of pharmaceutical advertisement, and why don't we promote exercise, less sugar drinks, less latte, frate, sugar coffees, less donuts, less crackers and oats and donuts and pie and ice cream and candy, and less party celebrations that go on continuously now all the way through Valentine's Day. I am for stopping putting the sugar in here and the fruit sugar and not giving you silly drugs that have serious potential side effects. So that's what I think about it, Alan. Um, Alan says, all right, Constance says, is Parkinson an inherited disease? My brother was diagnosed and no one in our family has ever had it. I think it's due to long-term drinking alcohol habits, no longer exercising, and eating a horrible diet. I agree, and I agree. Since dopamine is the issue, can't he eat foods that produce dopamine, stop drinking, exercise? Parkinson meds are so bad, she states. The answer is yes. He can do all those things. Is Parkinson's a inherited disease? There is no evidence to confirm that. You'll see it's possible, maybe. That's their nice way of saying keep on sending money for genetic research and don't talk about lifestyle changes, because then we won't have a job. We won't have so many sick people. So, Constance, I really am saying, if it looks like it's running in a family, it's probably because that family has a poor lifestyle of staying up late, watching the blue light TV and their screens, sitting on their butts too much, not exercising, drinking soda pops, drinking diet soda pops, not drinking any or hardly any water, eating high carb snacks, fried, high hydrogenated foods, these kind of things. And then, not to mention the heavy metals and all the uh, skincare products and shaving creams and deodorants and makeup and hair products that we use that have all these toxic effects on our bodies and our neurological systems. And yes, so I'm going to say likelihood of genetics extremely low. Likelihood of environment, lifestyle extremely likely. And so, yes, EDTA chelation therapy, high dose vitamin C, systemic enzymes, exercise, plenty of hydrational fluid, water, not eating late, low carb, all these things are the direction that is needed. Leslie says, may I take all of my supplements at night? I don't see why not. The B vitamin complex may give you energy and might be overstimulatory for your sleep. I, on the other hand, I'm a B positive blood. I could drink 16 ounces of hot coffee before I go to bed. I have such a slow metabolism. So um, I can take my B vitamins and nothing stimulates me. So it all depends, Leslie, on how you respond. So, but there's no real reason why you couldn't take it then. Jackie says, have you heard of Dr. Garrett Smith? Yes, I have. He believes liver detox is the key to healing disease and has a whole protocol where you avoid vitamin A. I'm just learning about it, but wondered if you have an opinion, if you're familiar. Thanks. Well, what people call vitamin A, um, you know, carotenoids like your carrots and your yellow vegetables. These really are not vitamin A, they're precursors to it. Your body has to be able to absorb it and then to convert it into the vitamin that's very important called retinol. Therefore, I think much of the data on vitamin A and disease is misunderstood. There are many serious problems with vitamin A deficiencies, especially young kids today. Dry eyes, dry skin, frequent upper respiratory infections, um, uh, having mucous membrane problems, and the list goes on. So, if you're taking these other quote unquote vitamin A supplements that are like carotenoids and high carrot diets and juicing them, you can actually get toxic side effects from it. Now, what is the safe and wonderful way that I know you'll never overeat vitamin A? Uh, eat some liver. Liver is rich in vitamin A. Eat any liver from goose livers to cow liver, lamb liver, anybody's liver that's an animal. And it's a very healthy source of multiple nutrients. It's the most nutrient dense food, probably, and rich in healthy retinol vitamin A. I've never, ever seen anyone, including myself, overeat liver. Secondly, egg yolks. I've never seen people like on uh, that movie with Paul Newman, where he's on this penitentiary and he took a bet to eat 50 eggs. So, egg yolks would be another source. What would be another source? I can't think of one offhand right now, but vitamin A, you need it. You really can't live without it. And you're going to have colds and infections and mucous membranes and dry eyes and neurological problems if you don't have it. So swallow down some egg yolks or liver, those kind of things. And Dr. Garrett Smith, the liver is extremely important, but everything is important. If he's emphasizing the liver detox, because the liver has enzyme patterns that detox package to help eliminate toxins in our world. So it's very important to take care of your liver. He poo-poos alcohol. He's a naturopathic physician in Arizona somewhere. Yes, it's wonderful, and I agree with that, but it isn't the end all be all. Uh, you have to have a doctor who is available, who will say everything matters, not just your liver and how you're treating it. It's how late at night you eat. It's how much you exercise. It's how much water you drink. It's, are you taking your enzymes? Are you on natural hormone replacement therapy? Are you taking too many fruits? Are you juicing? Oftentimes we're over damaging ourselves with juicing, pulverizing things. We're making this absolute easy to blast our system, and our system was never meant to see that blast of blender Vitamix kind of stuff, uh, juiced up material. It's just too much fructose. That's very hard on the liver, and I could go on and on. So we should eat real food, get away from processed food, eat out less often, try and cook at home, not eat late, stay active, and go from there. And let's see, Whitlock says, Dr. Rita, this is Libby. Hi, Libby in Charlotte, North Carolina. Have been using the analemma rod. Okay, so she's talking about this thing right here, this analemma rod. And inside of this rod is structured water. And when I put it in my glass of water that I drink from every day, my glass, I'm drinking structured water. And it says, does it interrupt the benefit of the structured water if you add powdered minerals to the water? Blessings. No, there's no study that I'm aware of that they have done from the company. But I'm going to say the answer is no, because structured water will eliminate those minerals from coming to the cell membrane surface. It's that exclusion zone that structured water does. So it won't harm it. That's fine. Tiziana says, can you recommend a PEF mat brand? If you call here, Tiziana, and ask my nurse, Terry, she can walk in the back room there and see what our PEMF brand is. I can't think of the name of it, but I've used it. And it's probably the most researched one out there. I've probably had it 15 years now. And they've just, that company's grown and grown. Yeah, so call Terry and she'll let you know. Carolyn says, my sister-in-law took herself off metformin and then had a stroke. She thinks it was the cause. I don't think so. How much water was she drinking? What was her blood sugar? What was her insulin level? What was her hemoglobin A1C? What was her HSCRP? What was her sedimentation rate? How active was she? How late at night was she eating? These are the questions I would ask. And then Annetta says again, what do you mean by systemic enzymes? There are two kinds of enzymes. One enzyme is to be absorbed in your whole body and all your joints so that you can be in your 70s and not have any joint pain, because it's anti-inflammatory all over your joints and your sinuses, everywhere in your body. You take systemic enzymes on an empty stomach. You don't eat for 2-3 hours so that it can be absorbed into your whole body. Digestive enzymes are what I take when I eat food so that I can help chop up my food in my stomach. That's what I mean by that. And it looks like it's 4 minutes after 7. I've gone over. And so I have 1, 2, 3, 4, 5 questions on the email I didn't get to. I'll do it next week. God bless you all. Have a wonderful night. And God keep us and help us to be kind and loving to one another. Whatsoever lovely, beautiful, of good report. Think on these things and help each other for the best. All right. Take care. Good night.